good people, once again I welcome you back to the Nursing Moms YouTube channel. I'm Nurse Janet, and in this video here today I want to talk about induction of labor. I'm going to answer the following questions about induction of labor: the reasons why labor can be induced, the contraindications of induction of labor, how labor can be induced, and is induced labor more painful than the natural labor? And again, lastly, I'll talk about the complications of labor induction. Stay tuned. Labor induction simply means the process of artificially stimulating the uterus to start contractions before the spontaneous onset of the contractions. Yeah, that is how simple I can explain induction of labor. There are several reasons why labor can be induced, and one is postdatism. Postdatism begins from 42 weeks. And in postdatism, it simply means that any pregnancy that is up to 42 weeks without any sign of labor, there is high chances of what we call placenta insufficiency. This means that the placenta will stop offering the functions that it was doing previously to maintain the pregnancy. So there is high chances of losing this pregnancy, a pregnancy that is going past 42 weeks. The doctor will find it wise to initiate labor if there is no any other spontaneous onset of labor to save this precious baby. Another good reason why labor can be induced is when you've had a spontaneous rupture of membranes after 36 weeks of gestation, and in these first 12 hours after the ruptured membranes, there is no sign of labor. Yeah, this will put your baby at risk. Remember, you've drained a lot of liquor and there is high chances of even getting infection. So the best way to manage this, that the first 12 hours there is no any sign of spontaneous onset of labor, the doctor would decide to induce labor. The third reason for induction of labor is if your baby has died inside the womb, there is no need to continue with the pregnancy. And so the best thing is to induce labor so that you expel or you give birth to your fetus. It's unfortunate, but it's the best way to get out that. Labor will also be induced if you are having hypertension in pregnancy, especially that is still with mild to moderate preeclampsia. This one will be done in order to prevent further complications of things like eclampsia that can risk the life of both the mother and the baby. Conditions like gestational diabetes. This is pregnancy-induced diabetes. Yeah, remember, diabetes in pregnancy always results to having big babies. So after 36 weeks of gestation and everything stands normal, it's advisable that this kind of pregnancy should be induced to prevent any further complication from the diabetes, and again, the possible complications of giving birth to a big baby. The following are contraindications of labor induction. Number one, you cannot be induced if you've had previous scar. If your previous delivery was through cesarean section, then in your subsequent pregnancies, it is impossible to have an induction of labor. Another one is what we call cephalopelvic disproportion. This means that in this specific pregnancy, you cannot give birth vaginally for different reasons, like maybe the baby is big compared to the birth canal. Another good reason why labor cannot be induced if you have low-lying placenta. If the placenta, that is what we call placenta previa, if it's centrally located on the lower uterine segment, that is type 3 and type 4, then it cannot allow vaginal birth. This specific reason cannot allow labor induction. Another good reason why you cannot have labor induction is if you have what we call malpresentation. Your baby is not presenting normally, like any position that allows vaginal birth. Then for this specific reason too, you cannot have an induced labor. Before labor is induced, the doctor will check on several things like your cervix, if it's ripe or not, the gestation period, just to be sure that whatever he or she is doing is okay. And again, there are different methods of labor induction. We have the medical and the surgical method. On medical method, the doctor will be using drugs, that is the prostaglandin, the misoprostol. The prostaglandin actually is to ripen the cervix. And we have the misoprostol that will initiate the contractions. At times we can even use the oxytocin. And on the surgical methods, there are different methods are going to be used on that. And lastly, labor induction can have complications. What are some of the complications of labor induction? Most of these complications result from overstimulation of the uterus, and the first one can be uterine rupture. Yeah, overstimulation of the uterus can lead to rupture of your uterus. It can lead to fetal hypoxia, that is the fetal distress just due to overstimulation of the uterus. It can lead to postpartum hemorrhage. It can lead to placenta abruption and fetal hypoxia. And again, labor induction can also fail for different reasons. We can have a failed induction. And the question of whether induced labor is more painful than the natural labor is true. Yeah, induced labor is more painful than the natural spontaneous labor. Reasons being, first, you are using drug to initiate contraction. The process has some discomfort in it. The uterus can be hyperstimulated, leading to vigorous contractions. Yeah. So if you are planning to go for an induced labor, maybe for your own personal reasons, remember the induced labor is more painful and it can also have some complications. So if there is no any other reason that is really pushing you to have an induced labor, any other medical reason or an advice from your gynecologist that you've thought about it on your own to go for an induced labor, kindly hold on and wait for the natural labor.